Hi, everybody. We are live here with our episode of The Teenager Seeks, and I have a guest today, a special guest. My special guest is passionate about psychology, and her name is Priyanka Bhandari. She's a mental health professional. Priyanka, you are trained in cognitive behavior therapy. You are currently finishing your clinical psychology. You're doing your master's and you have interned with Fortis, Silver Lining. You've also been in the corporate sector in Delhi, Mumbai, and Brussels. She's an author with Juggernaut, and she has also attended a workshop at Nimhans on mental health. So that's a blue chip background in mental health training. Hi, Priyanka. Welcome to this show.
Yes,
I
hi, Nidra. I'm so happy to be here and good evening, everybody.
Priyanka, I can't believe I've got a surreal feeling that we're actually talking about it because my caregiving started in 2013 and I used to wonder, am I alone? And I used to dream about talking with a professional. And I had these, whole lot of these questions. And today I get an opportunity to ask you those questions. So my first question to you, Priyanka, is what is the core principle in caregiving?
Uh, I think when we look at caregiving, uh, especially when it is caregiving in mental health, in the area of mental health. So I think one of the core things is that we have to look at the at the patient as an individual. A person is more than his illness. So, a person is a mother, an artist, a wife, whatever, and he happens or she happens to have the illness. So, why this becomes so critical is that, let's say, say one morning, a daughter with depression wakes up and says, I'm feeling terrible and I just can't wake up. And you kind of know that it's, probably she's missed her medicine the previous night. And if, so you get yourself together and you say, I'm going to be this very nice mom. And very nicely, very gently, you say, Beta, did you have your medicine last night? And she shrugs her shoulder and walks away. And you're like left wondering, what happened? Right? So it's actually in that moment, all that she was looking for was empathy. Just for you to be able to hear that she is suffering, which honestly is very tough for anybody to see our patient whom we really, really love just suffer. And so what comes instinctively to us is that we offer a solution. So we'll say something like, why don't you go for a walk? Let's do meditation. Now, the point is that, we know that she, it's not that she's not capable of thinking of these answers, but she was just looking for empathy. And this empathy in this form is something that we're not used to. We didn't grow up with this. And so it is a skill that we have to develop. It's like back home, when I was a kid and I came back and I told my mother that I don't have a friend. So my mother would tell me stuff like, go join badminton, be more sharing, etc. But I don't remember her ever sitting down and saying, Beta, that must be tough for you. So
Yes.
that actually is the crux of it. Because once we can get a good level of communication with our patient, things become easier for the patient and us.
So I'm hearing you say, Priyanka, that empathy is the core principle. However, a caregiver's life every day can be so frightening at times and so isolating, so lonely.
Yes.
In the beginning, you don't know where to go, whether to go to a psychiatrist, whether to go to a healer, whether to go to a therapist. It's frightening. You really feel very alone. And
True.
under those circumstances, my question to you is has the caregiver been traditionally so neglected? There doesn't seem to be any role or any space for the caregiver in the mental health
Yeah,
industry.
literature. So I think historically what happened, one of course was prioritization. The graver illness gets more resources. And the second, it was a reflection perhaps of our society. historically and culturally, we've kind of grown up to believe that the lady of the house is the caregiver, and it's kind of taken for granted. Her services are taken for granted, and uh, and so that reflects in funding for our research. And thirdly, I think this whole concept of self-care is confused with selfishness. So it's like,
Right.
and so the caregiver really did not come in the spotlight in the society per se, and therefore in literature. But having said that, things have changed now. Last 10 years, there have been a lot of research. There have been statistics showing how it has impacted their health and how it can be turned over, how it can actually become a rewarding journey rather than, as you're saying, a journey of isolation, of self-doubt, of guilt, of regret, of, did I do the right thing?
Yes. Now, another major problem that caregivers face is to balance what you're calling empathy with what they really need to have their patient do. For instance, take their medicines and go for therapy, follow the treatment protocol. Many a times, a caregiver is constantly debating whether they are empowering or enabling the child. And how do you approach that?
So that's such a pertinent question that, just because I'm giving empathy, does that mean that I do not affect change of
Yes.
behavior? And if I have to do that, how do I do that? So here, especially when it comes to adolescents, there are basically two things. One, there's something called an emotional bank. So every time we ask a child, whether he's a child from mental health or otherwise,
Right.
have a bath, go down, walk, whatever. It's You're really drawing on that emotional bank. And then so therefore, what is it? How do you deposit into the emotional bank? You deposit by chilling with the kid. So whether it is post-dinner lines, just chatting with no agenda, or if in the case of mental illness, let's say, somebody is under a major depressive disorder. So probably the chilling will really refer to just sitting in his room, just being able to sit and hear his rather, negative, you know, thoughts, and not dismissing them, just hearing them, just to let him
Yes.
know, I know you feel that way. So once we have enough of an emotional bank, and we know this is a good space, then we say we do something called a buy-in. So we
Right.
know what are our top priorities. We need him to have medicine. We need regular visits to the doctor. So that is when we kind of set it out for us. So we say, okay, fine. So let's find a system. So there is actually a prescribed problem-solving method, which is given in Milkowitz's therapy, which is that both of you sit together when both of you have a good, you are at a good space, discuss, agree that there is a problem, then both come up with solutions. And in this, it's very important to be genuine. So if I have the solution already in my mind that I want to give her the medicines
Yes.
in her hand, it will not work, because what I don't say will peep in through my body language, actions, tones. He or she is going to perceive it, and then that problem solving is not going to happen very well. So genuinely try and get a collaborative solution. And so both of you sit and give ideas. And once those ideas are up, then you agree on, okay, fine, we will be doing this. And at the end of that, you appreciate the fact that you've been able to come together, sit down, and really talk about it. And so once you have a buy-in, let's say your buy-in is, I need the medicines to be kept outside the room so that every day when I am passing, I can check, because a lot of patients in mental health do not, they want to be independent, and they do not like, too much of, when does protection become overprotection? When does it become counterproductive? Right?
Absolutely.
So it is in that space. And but once you've established a buy-in, and then you go back and say, and not at that time, not when he or she is telling you her troubles, but probably at a later time, that beta,
Okay.
today there were 3 medicines, I expected there to be 2. So once you've established your buy-in, she has her independence, you have yours, she has her respect, she is not feeling objectified. It's not every time she comes with a problem and, she feels that, oh, that's being dismissed as not me, but my disease. So that kind of really helps to
Priyanka,
start with.
I, I understand, appreciate what I'm hearing, what you're saying, but I'm also picturing a situation where, let's say, the patient is severely depressed and they're not hearing you, they're not even responding. Or, for instance, when in a bipolar disorder, for instance, let's take that disease where the patient may be manic and just not open to any incoming communication. And the lack of psychoeducation, most caregivers have no clue what they're dealing with. So we are running from a healer to a past life regressionist to Ajmer Dargah mein, chatar chada di, udhar Nanak Pyao Gurdware chale gaye, doing all kinds of things, thrashing around, going to an astrologer, for instance.
True.
What,
True.
what I mean, how do you? It's
So
frightening. It's frightening, Priyanka.
I think you really raised a very pertinent point about psychoeducation. I think that is the basic, and I really wish our medical practitioners, when they are attending to the patient, I wish they would take out that little time and tell the caregiver, because finally that is the ecosystem in which the patient is being recovered, right? So and because, like you said, for example, so if you have, I mean, psychoeducation is basic, because once a caregiver knows that what are the pitfalls, what can I expect, where do my expectations, therefore where should my expectations be. For example, in bipolar, when a patient is in hypomanic or manic, that really means he's feeling high, or uh, feeling like
Yes.
I know everything and I know
Yes.
exactly what I'm doing. Now in that is actually the phase in which they stop eating medicines.
Right.
And so if I am already aware of this and I've already got a buy-in, so I still have a standing that, you had promised me
Hmm.
and we will
Okay.
have it and it's not happening, right? And some of them do not have that insight. Some have insight and some don't. Very often they don't have insight. So
True.
specifically, it becomes more difficult for the people who don't have insight. But if you don't have psychoeducation, you're just getting mad. You're like, boss, the doctor said, we agreed, why are you not doing it? But if you already know, then you're coming from a calm place. And so, you're trying to at least trying to have an adult to adult conversation. So that, those things help.
Yeah. But Priyanka, the lack of awareness is so acute many a times because these are not things that we talk about. That is not normalized yet. And if you heard more people talking about depression and what are the signs to look out for, perhaps you would be more effective as a caregiver. But since those conversations are not happening that much as yet, you'll have people who delay acknowledging, delay recognizing that a depression is coming on, and then you're losing some very, very crucial time.
True.
These and then the reaction of the community around you, the reaction of the family. So, in your experience, what kind of support have you seen the
So
caregivers receive from the environment?
right. So again, that's a very pertinent point. That one of the major things plaguing people from getting help in mental health is stigma, and very often it is actual stigma. Like, what would your neighbors say? Is she a bad mother? Did she put too much pressure on the kid, or
Yes.
whatever else? And
Mm,
some of it is actually perceived stigma, because there are people now who have who have kind of woken up, especially in the younger generation. And you being a generational speaker, I think you would be really the best person to talk about this. But I think the younger generation, they are far more open and they
yeah,
have not
absolutely.
stigmatized mental health. And now, but having said that, most of the people around you, 80%, like I can go and ask somebody, I need a gynecologist, could you recommend one? But when I
Right.
talk about I need a psychiatrist or a psychologist, people are judging you. They're sitting and judging you. And so I think one of the things that really helps is support groups. So, because what happens essentially in a support group is, like, I've personally worked with one called Caregiver Sati. And what what happens is that there is a shared experience, and the
Right.
fact that it is a closed confidential space, one can talk. So the caregiver can have catharsis, she can talk about it, she can normalize her experience. There is learning, like you said, there are learning and efficiencies from that experience because others have gone through it. They teach you by their experience. And a lot of these groups have, coaching and counseling, and whether it is webinars or individual counseling. And I think that normalization helps you to seek more help. So like you said, that the delay in, like, you can see the symptoms, but you really don't want to believe
Yes.
that depression is
Absolutely.
there or some other
Absolutely.
ailment is there or psychosis is there. Psychosis is again a very, very difficult acceptance. But the moment it gets normalized, when you know there are others who are like you and who are suffering, or somebody in their family is suffering, it helps you, and then you can go for specific help groups. So like we have a few. We have Bipolar India for BPD, for borderline personality disorder. We have Mumbai BPD, and Safe Spaces. Then there's one for Alzheimer's. And so the moment you tap into these resources, you just feel more empowered
Yes.
because you have the knowledge, you
Right.
have references for doctors, which becomes a very critical thing in this space. So I think that helps. And as a society, I think it's really sad that, we have evolved so much, and yet, there are things we need to do. There are basic, simple things. One being that, just don't be judgmental. And when you are attending to a caregiver of mental health, or frankly for any other ailment, be a good listener. Don't be there
Right.
for the gossip. Be there for the empathy. And the last thing is that, don't pity. Somehow we have this culture of oh bechari, oh poor thing. But instead of pity, if you could replace pity with support, how can I help you? Can I be there on Sundays? I have time on Sundays. Do you want me to do your groceries? Do you want me to, probably sit with your patient for a while, for a bit, while you go and do something which is critical for you? And so that's the kind of support we hope our society will give us.
Right. What I see with families is that only a parent who is so invested in their child, only a parent can really appreciate it's a pain that the patient is going through. It's a deep psychic pain. It's at a emotional level, psychological level, and I do believe at a psychic level. And what I find is that parents are able to appreciate, but for a lot of others, the attitude is quite prescriptive. Why don't you make sure that the child eats medicines? Why don't you make sure that the child does exercise? And perhaps you're not doing enough. So that appreciation, that sensitivity, that this is a person that you're dealing with, and there's no way that you can browbeat that person, especially, I mean, of all ages, and in particular the younger children, uh, teenagers, young adults. Have you
True.
have you have you
And
found that? Have you seen that
yes,
happening?
and I appreciate when you say parents always get it, but in our experience, sometimes it is rather sad because the parents are not, for example, in depression. So depression is it's a spectrum. So it goes from
Right.
mild to moderate to harsh. So there was this particular case when the parent came and said that, this kid is faking it
Oh
because I
gosh.
see him in the evening, he's talking on his, the video call with his friends, and I can hear laughter outside his room. So if it was depression, how is he laughing? Now, to be honest, it's a matter of pity because the poor father is not, doesn't know enough. Right. So it could
True.
be that the child is putting up a mask. A lot of people with depression put up masks with, at different points of time. You don't want people in your school to know, and you are in a moderate state. You can do that. Or maybe you're just in a moderate state. So there are times when you can laugh, you can be happy, and yet there is a feeling of hollowness and emptiness.
Yes.
So it becomes very critical to educate, not only like you're saying, not only the parents, but also the larger community.
Absolutely.
So like, we actually technically have something called family therapy,
Mm.
which is which encompasses not only the parents, it encompasses all the people who share space with the child, with the patient. So
Mm.
it could be grandparents, it could be a cha-cha, it could be anybody, around.
Mm.
And the idea of that, the whole thing is to sit with the therapist, so the therapist also understands who is feeling what and what are the issues to be addressed in a larger environment.
Mm.
And within this space, you have specialized therapies like Miklowitz's family focused therapy, which is for which you need to be a certified practitioner. And
Mm-hmm.
but for other practitioners, it's a it's a basic understanding that this is what we need to do.
Right.
Now, having said that, it is almost unfortunate that in India, at least, we see very little of that happening.
Right.
And so then the question comes, why not?
Exactly. Why not?
Why not? So, to be very honest, one is that we have very few certified family counselors.
Yes,
And
the ratio.
and the other thing which is rather bothersome is that to do a family therapy, you have to convince the patient, the
Mm.
the people around, and
Absolutely.
that requires a lot of effort. Very often, it is the patient himself or herself who will not go in for a family therapy, because the whole concept of a therapist is that this is my personal space with you. But then it is the responsibility of the therapist to convince the patient that while I will sit with everybody, there will be no way I will judge you for what they say, or for or tell them anything inadvertently which I about you, which I would not
Mm.
otherwise tell because of confidentiality. Now this
Mm.
is an uphill task, and most people just don't do it.
Yes.
So
And the reason it's so crucial, Priyanka, is that a patient sees a psychiatrist for, let's say, 20 minutes, it's mostly prescription of medicines. And then you go to a therapist for a 45-minute session. And then you come back. This is happening once a week, once in 2 weeks, sometimes once in a month. And there's an entire ecosystem waiting back for you. You go back to that ecosystem. And where does the treatment go? What direction is it taking? It appears on the outside quite chaotic. And I
true,
don't think
because
there's a way there, and this thing about confidentiality, because many a times the parents and the family are stuck so badly, they don't know what's going on with the child, how much to push in the sense nudge, to what extent.
to have a
Uh,
direction, basically.
yes, yes.
Basically, the team, the psychiatrist, psychologist team, just like they help the patient, they
Mm.
have to help him in a holistic way.
Holistic
And
way.
in order to do that, they need to give direction to the parent, or the caregiver. And in that, really, it is a matter of that initiative, unfortunately, has to come from the medical fraternity, because when
Mm.
as a caregiver you approach a doctor, he very often he is skeptical.
Right.
Is she trying to get to know confidential stuff, what is happening? But
Mm.
actually there are unfortunately there are few, but there are people who, after every time the child or the mother or the patient visits, they
Mm.
will take that effort to spend that just a small 5-10 minutes with the caregivers, just giving him an overview, saying this has
Mm.
happened, I'm hoping this to happen, just that. But unfortunately it is not. And what I think really happens is that the patient start that the caregiver, he or she starts blaming herself and the situation, and it
Mm.
just goes into hell. So if I'm in a state of hell, with really low emotional reserves, how am I going to help my patient? And so therefore, I think the other thing very important for a caregiver is to learn to learn to forgive the situation,
Mhm.
and and like normally when we talk about forgiveness, we only talk about forgiveness of the offender as in a person, or forgiveness
Mm.
of self. But in order to accept the situation, you need to have forgiveness, for the situation, that you voluntarily, forego the resentment and embrace the situation with love. And I think once you do that, then you are at peace with the situation. There's no longer question of why did this happen to me, or
Right.
that this is a battle. That stress is out. And then
Okay.
perhaps in that space, you are in a better position to explore other options, to psychoeducate yourself, to understand the holistic thing that's happening around the patient.
There may be some legal aspects involved in sharing information of the session with the parents of the caregivers, because privacy is an issue, and with the Mental Health Care Act 2017 that came out, it gives cognizance far more to the individual and the individual's rights, the person that is suffering. So perhaps there's a legal issue there. However, you would have seen and read and heard about non-compliance from patients, and many a times it's not uncommon for patients to take themselves off medications. Then there's a roller coaster ride, then you come back to medication. What, in your experience and in your studies, what can one do, a caregiver do, to avoid these dangerous, you
Uh,
know,
yeah, so
experiments?
I
Yes.
think what the caregiver has, I mean, what the caregiver should do, given that we can't change the other side. So the caregiver needs to approach the professional and say, and take an appointment, which is, I think, the moment you pay for an appointment and take an appointment, somehow the provider also has more time and focused on you. And you say, boss, I do not want to know anything confidential, but I am lost. I don't know where this is going. So you actually
Yes.
write down your points, you write down your doubts, and very often the psychiatrist will meet you. Very often the psychologist or the therapist may not agree to meet you. But at least the psychologist will, and hopefully will give you a nice broad outline on what is to be done. So I think that is,
That's one way to approach it.
that is
Okay.
one way to approach it. And the other is to hit your patient when he or she is in a calm state. To say, this is what I observe. What do you want me to do? How would you like me to help you? Uh,
Yes.
and But this can only be done, like, not when, when the patient is in a roughly normal, better phase than a high or a bad
Right.
depression.
Right. So be alert. Be alert to the opportunities, to the windows where you can connect and convey.
True.
Many a times, the mental health sufferer tends to move away from the family or the support system around them. I've seen that happen with the young people more. So
That's true.
they will tend to move towards their friends and move, or get distant from their parents, because I think in the parents' caregiving they see perhaps a lack of validation for themselves.
I
Have
think,
you have you
yeah,
seen that?
what I have really seen a lot is that very often the caregiver, the patient,
Hmm.
lashes back on the caregiver,
Right.
um, and the moment it goes into the area of blame, you did
Oh,
this, and
oh
so this
yes,
happened. Now,
yes.
when this happens, that is to cope with that, the caregiver needs a skill. It's called walk away from conflict, and don't react, respond to the situation. So the moment that happens, the caregiver needs to bite his tongue and to look at, what are the things that could be happening. One, of course, it could be because of the disease, because certain disease heighten your sense of sensitivity. There's filtered thinking. You only think about the negative and displaced anger, etc. And if that is the case, then the caregiver needs to realize that it's not, don't take it personally. This is something which is because of the disease, but unfortunately, because the patient feels it, it is real for him or her. And therefore, I have to sit down and I have to address it in a cool, calm manner. And the other thing, which I think also a caregiver needs to do, is that sometimes maybe there has been an oversight. Maybe I was not as sensitive as I should have been. Because,
Right.
ultimately, I very strongly believe that it is the neurodiverse that bring in new perspectives into the world. They bring in new sensitivities. They teach us, they teach the society to be more, more patient, more gentle, more sensitive to a whole lot of host of topics. And so maybe that genuine reflection is also a part of caregiving. And then,
Right.
obviously, if you're wrong, then you just apologize and say, I'm sorry, I didn't, I did this. And, this is where I came from. But having said that, I have hurt you and I'm sorry about it. So I think broadly,
Yes. Priyanka, there's another thing. A lot of caregivers have a problem distinguishing certain behaviors as stemming from the illness or stemming or the the patient's volition. How do you tell what is coming from a bipolar disorder or a borderline personality disorder, and what could be, let's say, manipulative, deliberately manipulative behavior?
yeah,
There's a lot of
that's,
confusion there.
yeah. That's a very tough decision, even for a trained psychiatrist or a
Hmm.
therapist, and for a caregiver it would be almost like, well, in many occasions it would, really not be, you could never be 100% sure.
100% sure.
So you do come to an area of doubt, an area of, let's give him the benefit of doubt, or let's give her the benefit of doubt. But then not always. So when do you put your foot down, and when do you, and that really comes from psychoeducation, that, when you really, really know the disease, you're in a better place to predict whether this one, is which part is this coming from.
That's a tough one because I think it's a struggle with a caregiver always, because you don't want to enable, and you keep hearing about this, that even a person with a mental illness has a certain accountability and a certain responsibility. Just the fact that they are mentally ill does not absolve them from assuming charge of, or at least making an attempt to assume charge, right? And
Right.
as a caregiver, you're always trying to draw that boundary, that
And end,
lines.
yeah,
Very
and end of the
difficult, very
day,
difficult.
yeah, and end of the day, you don't want him to use pity as a shield, right?
Absolutely,
You want
absolutely.
the patient to be empowered, to be able to stand on her feet, and yeah, so that is, that is the tough thing when it comes to mental health versus other illnesses.
And also, Priyanka, there's no way to predict how long it will take for a patient to acquire that insight, because ultimately your recovery from mental illness depends as much on that insight as it depends upon the environment and a shift in the mindset of people who are around you. They're more accepting, they become more kind, there's greater empathy, better your chances. But how long does it take a patient to arrive at that insight?
So
That is, it sounds like an eternal wait. You just
yes,
have to wait.
yes, it also varies from illness to illness, from person to person,
Mm,
and end of the day, it's also a matter of luck. Who get, when does
of
it
luck.
happen?
Right. With that, Priyanka, we come to the end of a session. Our time is up. That's been very interesting. And to all the people sitting there listening, any questions, you could put them later also. And all the very best, because this struggle is a tough one. And I think it's a factor of greater awareness that you see more and more young people out there who struggle with anxiety, with panic attacks, with an inability to cope, what you call fragility, and but I do believe that more such conversations will make it easier to address those problems and literally save lives. Lives are in balance here, as much as the young ones, the sufferers, as their families. And fortunately, Priyanka, one thing in India, it's still possible to collaborate with a mental health professional, right? In a lot of other countries, they are far more particular. The boundary is far more rigid, and it's
True.
perhaps difficult to cross and go over and help your child or somebody in the family suffering. Thank you so much, Priyanka. Any last words? And then we'll close.
Thank you so much for having me. And I think this is the best that we can do: talk about the subject and normalize it.
Right. Thank you.
Thank you,
And
Neeta.
yes.